A seizure is a clinical event caused by a transient disturbance of brain function due to an abnormal paroxysmal neuronal discharge in the brain. And if these episodes are recurrent without an identifiable cause, they are commonly described as epilepsy. So the term status epilepticus is used for repeated seizures, which occur without the patient regaining consciousness between attacks. The clinical presentation depends on the part of the brain affected. So patients may sometimes describe the warning signs termed prodrome or aura, which they experienced before the event. A detailed description by a witness is key. The general anesthesia and ventilation may be required in severe cases and where high doses of anticonvulsants are required. So the causes are congenital, prenatal or perinatal injury, fevers, especially in children aged 6 months to 6 years, as febrile convulsion, with cerebral malaria, infections, for example, meningitis, TB, HIV, abscesses in the brain, also metabolic causes like hypoglycemia, hypocalcemia, hyponatremia, hyperosmolar diabetic state, uremia, and hepatic failure, also idiopathic epilepsy, eclampsia, vascular diseases like hypertensive encephalopathy, stroke, myocardial infarction, space occupying lesions like tumor or malformations of the brain, head trauma, drugs and toxins, alcohol, antidepressants, metronidazole, drug and alcohol withdrawal, degenerative diseases like dementia, and also psychogenic causes. The symptoms are loss of consciousness, tongue biting, foaming at the mouth, incontinence of stool or urine, aura, which may include a strange gut feeling, somatosensory manifestations like visual, auditory, gustatory, or um, olfactory. For example, strange smells or flashing lights, and muscle twitching and movements, which may be focal or generalized. And after a seizure, the patient may be confused as post-ictal confusion, or may sleep for some time. That's a post-ictal sleep. The signs that are usually elicited are a prodrome or aura with automatism, sleep, smacking, picking at items, also muscle twitching and movements, which may be focal or generalized, post-ictal sleep, post-ictal confusion, thoughts paralysis, stroke-like weakness, which may rarely occur. So examine carefully for evidence of neurological localizing signs, tongue laceration, and evidence of trauma to the face or other parts of the body. Investigations are FBC, ESR, blood glucose, BE, calcium, LFTs, chest X-ray, electroencephalogram, and CT scan. The main treatment objectives are to stop the seizures, to treat underlying cause, and to prevent injury. Non-pharmacological treatment: you move sharp objects, fire, among others, away from the patient during seizures, ensure clothing around the neck is loose, and ensure that the airway is clear. Wipe or suction any secretions or vomiters from the mouth or nose, and do not force a spoon or tongue depressor into the mouth. Remove false teeth if present, and after convulsions cease, turn the patient into semi-prone position by turning the patient on the side with one leg bent and the other leg straight, and monitor fits, usually with a fit chart. Or pharmacological treatment in acute seizures as the immediate emergency measures. First line treatment, you give oxygen by nasal prongs, 2 to 6 liters per minute, or face masks 4 to 8 liters per minute, or non-rebreather mask 10 to 15 liters per minute. And also you give lorazepam slow IV in adults 4 milligrams as a single dose, repeated once after 10 minutes if necessary, and given into a large vein slowly over 3 to 5 minutes. In children 12 to 18 years, we give 4 milligrams as a single dose, repeated once after 10 minutes if necessary, and given into a large vein slowly over 3 to 5 minutes. For 1 month to 12 years, you give 100 micrograms per kilogram with a maximum dosage of 4 milligrams as a single dose, repeated once after 10 minutes if necessary. For neonates, 100 micrograms per kilogram, maximum dosage of 4 milligrams as a single dose, repeated once after 10 minutes if necessary. Or you can give midazolam IV in adults 150 to 300 micrograms per kilogram, which may repeat every 10 to 15 minutes as required. For children 1 month to 18 years, initially 150 to 200 micrograms of midazolam IV, followed by continuous infusion of 60 micrograms per kilogram per hour. And you may increase by 60 micrograms per kilogram per hour every 15 minutes until seizures are controlled, with a maximum dosage of 300 micrograms per kilogram per hour. For neonates, you give 150 to 200 micrograms per kilogram, followed by continuous infusion of 60 micrograms per kilogram per hour. May increase by 60 micrograms per kilogram per hour every 15 minutes until seizures are controlled, the maximum dosage of 300 micrograms per kilogram per hour. Or can give midazolam buccal in adults 10 milligrams, repeat after 10 minutes if necessary. A third dose must not be given sooner than 12 hours after the second dose. For children 6 to 18 years, we give 200 to 500 micrograms per kilogram with a maximum single dose of 10 milligrams. Repeat after 10 minutes if necessary. The third dose must not be given sooner than 6 hours after the second dose in children less than 40 kilograms. A second line treatment, you give diazepam IV in adults 10 milligrams slowly over 2 to 3 minutes, approximately 2.5 milligrams every 30 seconds, and in children 200 to 300 micrograms per kilogram slowly over 2 to 3 minutes. And this may be repeated 10 minutes later if the fit continues. Or diazepam rectal in children more than 12 years, you give 0.2 milligrams per kilogram, and 6 to 12 years 0.3 milligrams per kilogram, and 2 to 6 years 0.5 milligrams per kilogram. 1 month to 2 years 2.5 milligrams, and neonates 1.25 to 2.5 milligrams. And this may be repeated 10 minutes later if the fit continues, with a maximum dosage of 10 milligrams. If a rectal formulation is not immediately available, draw up the injectable form directly into a syringe and administer into the rectum after removing the needle. So if the seizures continue, As in status epilepticus, you give phenytoin IV with ECG monitoring in adults 15 milligrams per kilogram, slowly at rates no greater than 50 milligrams per minute with a maximum dosage of 2 grams loading dose. And then your maintenance dose of 100 milligrams 6 to 8 hourly. And in children 1 to 12 years, initially 18 milligrams per kilogram, slowly at a rate no greater than 50 milligrams per minute, and maintenance dosage of 5 to 10 milligrams daily per kilogram daily with a maximum dosage of 300 milligrams daily. And 1 to 6 months, initially 18 milligrams per kilogram, slowly at a rate no greater than 1 milligram per kilogram per minute. Then maintenance dose of 2.5 to 5 milligrams per kilogram 12 hourly. Neonates, initially 18 milligrams per kilogram, slowly at a rate no greater than 1 milligram per kilogram per minute. And then maintenance dosage of 2.5 to 5 milligrams per kilogram 12 hourly. It may cause cardiac arrhythmias if given faster than 25 milligrams per minute. So never mix phenytoin with 5% dextrose to minimize the risk of crystallization. Instead, phenytoin must be put in normal saline. Okay. You can also give phenobarbital IV in adults 10 to 20 milligrams per kilogram. And repeat those at 20 minutes intervals if necessary. The maximum total dose of 30 milligrams per kilogram. Then starting 12 hours after initial dose, give 0.5 to 1.5 milligrams per kilogram 12 to 24 hourly. And children 1 month to 12 years, give 10 milligrams per kilogram at a rate not more than 1 milligram per kilogram per minute, and repeat after 15 minutes if necessary. For neonates, initially give 15 to 20 milligrams per kilogram start, and you may repeat those of 5 to 10 milligrams per kilogram at 20 minute intervals. The maximum total dose of 40 milligrams per kilogram. And then starting 12 hours after initial dose, you give 3 to 4 milligrams per kilogram 24 hourly. Referral criteria: if seizures remain uncontrolled within 30 minutes after they began, refer immediately for specialist attention, and note that oxygenation should be continued during transfer.